There's a lot of concern these days about what happens if I get too much injection on my face and there is an overcorrection of certain deficits. And it really kind of boils down to, number one, what was used, and number two, what that degree of overfill really is. If the filler was a hyaluronic acid fillers, then it's actually kind of simple because we really can reduce the amount of hyaluronic acid that was injected by injecting an enzyme that melts the hyaluronic acid called hyaluronidase. And the hyaluronidase makes the hyaluronic acid fillers very safe because you can really melt whatever was injected in the past. The problem lies a lot of times though in people who were injected with other material besides the hyaluronic acid fillers. And what do we do in those situations? And that's why it's really essential that we as plastic surgeons really can kind of like know what was injected in the first place. A lot of times an injected material that is not reversible, if that is the situation, then there are non-surgical and surgical options that we have, depending upon what the degree and severity of that overcorrection really looks like. For people who have just a mild sort of overfilled areas, we can use things like sometimes some steroid injection to actually kind of like decrease the amount of reaction that some people got, from these material. Sometimes what we can also do is give the face a little bit of a kind of a lift or skin tightening to kind of like take away some of that overfilled look. And some of these techniques that we sometimes use are things such as ultherapy, which is an ultrasound device that kind of tightens the skin, as well as melt a little bit of that scar tissue underneath. Or things like Morpheus 8, which is a microneedling with radiofrequency device that also kind of tightens the skin as well. One of the things that we can do in terms of lifting is using threads to kind of lift the sagginess that we have once the material is removed. For anything that's moderate or severe, then we really have to kind of think about, can we remove some of that injected material? And to remove those injected material, besides kind of trying to melt it with steroid or hyaluronic acid, sometimes what we have to do is we have to do surgery to try to remove some of that while we actually do a little bit of lifting. Because whenever we remove a foreign body, what happens is that there is going to be some laxity. And to kind of reduce that laxity, we can do some sort of surgical lifting, which will be more definitive while we remove the material at the same time. What's really important is, number one, identifying what was injected, and number two, what do we do about it? Okay? And everybody's really different. And that's why it's really important for the plastic surgeon to really evaluate the individual sort of cases that we actually see.